Hey guys, welcome back. Thank you again for joining us for another session of the RepPath podcast series. Where today we're going to pick a topic that a lot of people think is not as important as everyone really should treat it, because it's something that's extremely important. Especially there's two forms. We're gonna walk through uh, ride-alongs when you're not only getting a job, in the final stages of the interview process, but also when you're doing a ride-along with your manager. Okay, so these are two different types of ride-alongs, but we're going to touch on both and really cover the do's and don'ts, some of the best practices, and we'll even go over some nightmare situations that I've encountered, that I've been a part of, to make sure you guys stay away from. But before we begin, guys, obviously, please make sure that you're subscribing to our YouTube channel, which is Unfiltered Medical Sales Coaching, because in order to get the all the content that we're producing weekly here every Wednesday at 3 p.m., you can get the video recordings on our YouTube channel. Also, we're going to be live today on multiple platforms: YouTube, LinkedIn, Facebook, Twitter, podcast platforms, iHeartRadio, Spotify, and a few others. But also, before we begin too, guys, please make sure that from this moment on, submit any questions, thoughts, ideas, put them into the chat. Our producer James is gonna field all those, and then about halfway through, we're gonna take a little break and answer some of them. But please, whatever's on your mind, jump in. If you have any suggestions, anything's on the table here, guys. So please share whatever you feel like sharing. Okay, so diving right in, guys. Ride-alongs. Like I said before, there's two different types of ride-alongs. There's a ride-along that you would do monthly, every 2 months, maybe every 6 weeks with your hiring manager. And then there's ride-alongs that you're doing during the interview process. So we're going to start with the interview process. So a lot of you guys, when you get that ride-along, that's typically one of the last stages before you're actually going to get a job offer, in the interview process. So a lot of people think this is like coasting time, where they're going to make me an offer soon. They're not sending 10 people on ride-alongs. They really like me. They're putting all this time in. So now it's time for me to take the pressure off and kind of relax and enjoy the day and see what I can learn. And guys, that's the exact opposite of what you should be doing. Please do not do that. This ride-along is more important than any interview. Okay, this is the final stage. They did not stop grading you yet. So don't go into this like exams are over and it's summertime. It's not. This is the final exam that you have to come with your A game. Don't let your guard down, because a lot of reps think, I'm not with the hiring manager today. I'm with the rep. The rep's cursing in the car, very relaxed, maybe talking about sports, just you kind of let your guard down in these moments where you're thinking, hey, you know what? I could just relax and just shoot the shit with him, and it's no big deal, or her, whoever it is. But you don't want to do that, guys. Treat this like you're in front of that hiring manager, or you're in front of the VP, the final decision maker. This rep that you're working with is just, if not more important than anyone else you spoke with. Okay, because I've seen reps get to this stage, they let their guard down, and then they don't get offers. Because believe me, that rep is going back immediately and telling the hiring manager everything that went on during that day, but they're definitely telling him if there's any red flags. Because this is the chance where the hiring manager has only spent an hour with you here, an hour there. Now this rep is with you for 7, 8, 9, 10 hours in a car. They're going to see the real you, and they will pull that offer or stop the interview process at that point if you're not doing the things they want you to do. Okay. So I think I beat that up enough that it's very important to nail the ride along. And so what are some of the things you should do before the ride along? Okay. And that's number one, is coming very prepared. Okay. This isn't a field trip, guys. This is a day for you to really learn, but showing them, always showing them. Remember, I always say this, guys, the whole interview process is a sales call. So you got to constantly show them, that this is what you'd be doing for a sales call. And the first thing you're doing is showing them that you're going to come prepared. Okay, so you're not just going into this ride along winging it. Never wing it, guys. Always research. If you have a couple of cases, for instance, I used to be in the electrophysiology space. So we were constantly doing cardiac ablations. So if I knew I'm doing for my ride alongs, I would prepare. I would call the rep. Obviously, you're going to speak to that rep, know what that day is going to entail, and if you're going to be in a VT case or an AFib case or, a flutter case, whatever it is, you're researching all those cases. You're looking at videos online. You're coming there to learn, but you're going to be prepared. You're going to learn as much as you can. You're going to want to learn and research the products that you're going to be using during the case, and all these are going to create a lot of questions in your head. So you're not supposed to know everything. That doesn't mean, oh, I'm going to research everything and be a professional when I get in this case. No, you're going to have a good understanding, but you're going to show them that you prepared. So you should have a lot of questions. You should not know everything about an AFib just because you watched a couple videos. So you're doing research ahead of time, but you're also coming with your most important tool for a ride along, and that's your notebook. Get rid of the phone, guys. We're going to talk about that over and over. Your notebook is more important for that ride along than your cell phone. If you left your cell phone home, I'd rather see that than not bring a notebook. Bring your notebook. Have a pen and pad ready to go. Have all your questions that you want to learn, because you'll be able to ask questions during lunch or during, the car ride in between hospitals, where that's the time to learn. Okay. So get that research in, not so much to learn so much about the heart in a day or two. It's to have those questions prepared. If you're researching the products, if you're researching the competition, why are doctors using product A over us? Or why do doctors choose our product over product B and C? So you want to have that, because it's going to show that, you're here to hit the ground running, and you're always trying to own your development. Okay, that's a very important thing, guys. You want to always show these hiring managers throughout the process. I know I say it all the time, owning your own development. And the only way to do that is by putting in the work, guys. You're not waiting to be told what to do. You just do it. So go out there and prepare as best possible by speaking to that rep, finding out exactly what the day is going to entail, any cases, any acronyms that he's using, look those up, write down, I don't know what that means. I don't know what AFib means, anything, but make notes. You should leave like you just took, it should look like after a semester of note taking, in a biology course. Your notebook should be filled with knowledge that you gained during the prep process and then throughout the ride along. So make sure you're speaking to that rep ahead of time and knowing exactly what the day is going to entail. Also, look up the physicians who we're going to be calling on. Get a better understanding, but show them that you went the extra level to learn about Dr. Jones or Dr. Smith, and that you put in that research. This is your time to show that you really put the knowledge in. Again, you're not going to learn everything, but it's always showing that you're willing to go the next step. You're not just there for a field trip. It's not just driving around for a day. Let me see what, I'll get out for a while, learn about hospitals and doctors. No, I'm here to really hit the ground running. So put the research in with the hospitals you're going to, the surgery centers, the physicians. Try to get as much information on that pre-call with the rep that you can. And a lot of the reps, again, you're not sitting there for 2 hours trying to go over your day. It could take 5-10 minutes. Who are we going to see? What are our cases? And then it's your job to do that research before you get in there, and straight up ask, is there anything I should look up or anything else I can do to come prepared? So if you do that, guys, you're going to get yourself off on the right foot before this rep even meets with you, because they're going to say, wow, this guy's really hungry. because most reps do not do that. They just wait to be, hold my hand, tell me where we're going. You don't want to do that. You're there to learn. So let them know that, and you will be a step ahead by doing that, guys. Some other notes, go over, an understanding with that rep of what the goals are for that day. What's a good day look like? What are they trying to accomplish? Before you're going into every call, have that conversation. Okay, what's this doctor's background? What are we looking to do here? What other products is he using? Is he using us all the time? Or is it, do we want to get a greater percentage of the usage, whether it's a pharmaceutical drug or a medical device? Whatever it is, diagnostics, whatever product, you want to get a better understanding of what that rep is trying to accomplish on each of these calls. And a good rep will have that info. Sometimes they might say, hey, you know what? This doctor doesn't use us, but I haven't met him yet, but I'm trying to break in, so always try to get an understanding where you're part of a team. Make yourself a part of the goal of, like, what are we trying to accomplish here? And then again, obvious notes. Take as much notes as possible, guys. Writing all day is a good thing. Get off the cell phone. If there's one key takeaway from this podcast that you guys get, do not get on your phone unless it's absolutely necessary. Okay. No texting with friends about, your fantasy game last Sunday where you kicked your friend's ass and Jonathan Taylor scored 4 touchdowns and whoever, I'm drawing a blank on names right now, but Jefferson scored, had 200 yards receiving and scored 3 touchdowns. You don't need to talk about that and text with your friends. You don't need to text about where you're going this weekend or, stupid chat about gossip. Guys, stay off your phone, even in the car. Check your phone for emergency, family, anyone that's really needs to reach out to you that day. You can make a phone call during lunch or in between in a car ride, but leave your phone on silent. Definitely put it on silent all day. The less you check that phone, just think of it this way, guys. The less you check the phone, the greater your chances are to get the job. That simple. You might think I'm crazy, but I can't tell you how many times I've been on ride-alongs with reps, and we're literally in front of doctors, and they're like this, and they're clicking, and I don't know what the hell they're doing, nor do I care. I literally want to slap the phone out of their hand because we're meeting with a physician, and trust me, if I see it, that physician sees it. It's incredibly unprofessional. And a lot of you out there might be saying, why were you saying this? Who the heck actually does this? Believe me, it happens a lot. So keep your phone in your pocket on silent, have that pad and paper out. Okay. So obviously before you get in front of doctors, talk to the rep first, because you don't want to look like you're on the scene news reporter, just taking notes of everything being said. But you just want to make sure that the notebook replaces the cell phone just for that day. Trust me, it will increase your chances. And that brings the next step is, actually acting appropriately when you're in front of customers. This is not your time. And some of you that have more experience than others, you guys want to jump in more. You might know the doctors. You might have called in this specialty in the past. Today is not your day to be the superstar. You're here to learn and back out. Shut up. If anything, be quiet. If you're in a case and you want to get involved, do not get involved unless someone asks you to. You're there to help the rep and observe the rep and learn as much as possible. Ask the rep what he wants you to do, or what she wants you to do. If they want you to help carry their bags, help them carry the equipment in. Help them get set up. What can I do to make your day better? What could I do to help you out? I'm here to help. That's it. That day, you're here to help. You're here to be an assistant. You're not here to show off your knowledge or to take over and try to impress them. You will not impress them by jumping into cases that you don't have relationships in. you will piss them off, guys. Do not do that. Because some people think, oh, here's my chance. I know what they're talking about. I can jump in. Unless the rep asks you, unless the doctor, talks to you directly, which they rarely will because they don't know you, do not get involved. Okay. The better reps out there, and this is not even for a ride along. A lot of you guys, when they're breaking into this industry, think that to be a good rep, you have to just constantly talk and educate. It's not true. The good reps shut up and they speak when they're spoken to. So the good ones are calm. They control the room in a silence because they have everything under control. They're not jumping around just constantly giving advice and shouting out orders and telling people what to do. That's not what a good rep does. That's just someone that pisses someone off. Okay, so you always want to be in control, but be quiet, and you don't have to jump in every 2 seconds. So definitely in that ride along, do not speak unless you get the approval of the rep, or get involved unless that rep wants you to. Okay, again, you're there to help that person out, not to take over. When it comes to dressing, okay, if no one tells you what to wear, because depending, especially on the medical device side, a lot of times they'll say, hey, Joe, we got 3 cases tomorrow. Wear your scrubs, wear your powder blues. We're going to change into hospital scrubs anyway. Don't worry about it. Or they might say, hey, Joe, bring a change of a suit because we have a dinner at night after our cases. Whatever they tell you to wear, you listen to them. Follow their lead, okay? Because sometimes if you are going into a hospital and you're already, the rep's already in scrubs, and now you have to change out of a suit, not that it's a big deal, but you always want to talk to them first. You'll get that in that pre-call plan when you're learning about what you're doing the next day or in a few days. So make sure you're doing what they want you to do in terms of dress. If for some reason you don't know what to do and you didn't get a chance to speak to that rep, always come with a suit and tie on, guys. Always overdress rather than come in there assuming that you're going to be in cases or it's a medical device job, so I'm going to wear my scrubs. You don't want to do that, guys. Always come overdressed. You can never go wrong being overdressed. Okay, it sounds simple, but again, always, always, always come prepared. If you don't know, bring a change of scrubs and have your suit on. Okay, so you're covered. All right, so don't assume. Make sure that you're speaking to them first before you actually, decide on what to wear. Obviously, make sure, and this is another thing that sounds crazy, but shoes as neat as possible. Okay. I know the older, not to sound like an old man, but I know a lot of guys now in suits, they're wearing sneakers, or very casual shoes. It's not that I care about that, but guys, make sure they're clean and neat. Don't wear the shoes that have, scuff marks in them and are dirty looking, or they have mud in them, from the day before because you were going through a wet field. Guys, come polished. Suit, don't wear a suit that you didn't come from the cleaners. A suit that was dry cleaned. Look sharp. It makes a difference. You're here to impress, guys. You don't want that suit without creases in it. Looks like you wore it 5 times. You got the collared shirt that has wrinkles. Your tie is all scuffed up with a coffee stain. I've seen all this. So do not allow that to happen, guys. Come dressed and prepared, and as neat as possible. Okay. If you didn't shave, I got the beard, I try to keep it neat. Make sure you're just head to toe. You look polished and neat. They will talk about this. And we have had reps that they did a good job, but they're all disheveled looking, and companies are there. It's not about having a good haircut or getting the haircut they like. It's just showing them that you put the effort in to make all these, adjustments and come prepared. It's all about coming prepared. The more that you can give those signs that you came in prepared, it shows that you're serious about getting this job. So don't take that lightly, guys. Okay. I think I've beaten this topic up enough, but again, come prepared, come dressed neat, ready to go. And in terms, of being punctual, guys, always show up way early. I mean, I was someone, I have OCD where if I have to be there at 8 o'clock, I'm there at 7:15. I don't want to take any chances, especially for a ride along. This is to get the job. So if you got to show up an hour early and grab a coffee in the hospital lounge, or in a coffee shop across the street, do it. You don't know if you're going to hit traffic. You don't know what's going to happen. And the last thing you want to do is something out of your control. You show up 5 minutes late, and even though you left early, always make sure that there's nothing that could screw that up, because even if it's not your fault, guys, it doesn't matter. You weren't there on time. It's going to be a knock against you. So don't let that happen. Plan accordingly. Check the traffic, check the weather. There shouldn't be any excuse. Make sure you're there early. If you show up after the rep, to me, that was something that was a non-negotiable. I'm going to get there before that rep. I'm already going to be there. I'm going to text them and say, hey, what would you like? What kind of coffee do you want? That's a goal. Get there before wherever you're supposed to meet. If it's luncheonette, if it's a Starbucks, whatever, text them and say, hey, I'm here. Is there a coffee that you like? You would like something to drink? You want a water? Whatever. Show them that you're already there, prepared to go. Trust me, it goes a long way. All right. So again, always ask them, pick their brain throughout the day. Those car rides in between hospitals is about asking for feedback, getting more knowledge, learning, constantly learning. Again, this is when the notebook's out. This isn't check your cell phone, check who called. No, notebook out. Talk about the case you just came out of. Talk about the case you're going to. What to expect. What are some of the challenges? What does this doctor like to use? What does he like to do? Excuse me. Who are some of the other office staff? Like anything, learn. You're going to be driving in between hospitals, sometimes an hour at a clip. Use that time as a teaching moment, and ask them for feedback. Ask them what else they would do if they're on this ride along. What could they do, going into the final stages? Are there any things that you should be looking for in this next case that would help you learn quicker or is important to this case? Again, constantly learn. All right. So that's in regards to some of the do's, during those final, the interview before the ride along before the final interviews during that stage. So this is some of the don'ts, and we talked about some of these. But number one, don't dominate the call. Okay. Like we said before, unless a doctor speaks to you directly and asks your opinion, you look at the rep, you talk to the rep first, and you don't want to jump in and take over, guys. This is their customer. So you don't want to screw anything up for them. Okay. Believe me, if they need your help and they feel that you could bring some value, they're going to talk to you. They're going to ask you to give your opinion, but you don't want to jump in, especially if you did that research, like I talked about. And now all of a sudden, of course I want you to do that research, but don't think 2 days of research made you a know-it-all. And now all of a sudden you want to spit out knowledge, because odds are what you picked up in 2 days is definitely not enough expertise to provide a lot of insight. So just, again, quiet, sit back. Learning is more important than jumping in and just shouting out some information that you learned the other night. Next is in regards to abiding by hospital and office policies. Okay. You don't want to do anything that could jeopardize that rep's relationship or access in that hospital or in that account. If a sign says, do not walk through, or do not enter or whatever, don't try to push the envelope, guys, and look like you're a hero trying to get past security guards at a hospital or go into areas where you're not allowed to, just because you see a doctor that you might recognize. Do not. That is an absolute no-no, because if you screw up the access for this rep, you're never, ever going to be able to work at that company ever again. So do not do any of that. Respect the hospital policies, respect the office procedures. Again, this is not hero time. This is the time just to, let the rep take the lead. So respect all policies. I know that goes without saying, guys, but again, I've seen a lot of crazy stuff. So just respect office procedures. This is an important one, guys. Do not complain or gossip in that interview. And I've had this happen where, there's some managers out there that they're hard asses, and the reps could test you, and they could be, hey, how is Bill? He's a real pain in the ass, right? And then all of a sudden now your guard's down. You're like, oh my God, he was so mean. And then all of a sudden now you're gossiping and talking about the hiring manager, not realizing that this guy could be setting you up. So don't fall for that. Always maintain professionalism. Don't fall into complaining, gossiping, especially about your old company. You don't want to get into that too, where you're leaving and now you're opening up to this rep. I got to be honest, my manager really sucked. The products, they weren't that good. There was always some kind of issue there. I just had to get the hell out of there. You don't want to fall into that, guys, because they will report that. And they always think if you're talking about them, your old company, you're going to be talking about them soon too. So don't fall for that. Don't get too comfortable and start complaining. Okay. And the last thing, guys, just enjoy the day. Okay. So you want to get as much information, just to wrap up with these final interview stages and ride-alongs. Enjoy the day as much as possible. I know I'm giving you a lot of do's and don'ts, but really it's have excitement to learn that day. Look at it as an all-day training session that you're going to get submerged. You can research and look up videos for months, speak to 1,000 reps in the field that are in the industry. Nothing is going to give you that experience like a ride-along, because you're going to see firsthand what the real dynamic is in an OR or in an office-based setting. That use that, be excited, and just come in with that enthusiasm to learn, and you guys will do great. So to pivot from the actual interview process and now going into ride-alongs with your managers once you're hired. Okay, guys, this is so important because some of you that aren't in the industry or in the industry might not know what a CPR is. We used to have CPRs. They're coaching progress reports. Okay, where hiring managers, what they are, they're essentially riding with you for a day or two. And then after the 2-day ride along or day ride along, or sometimes 3-day ride along, whatever it is, typically 2 days, they write up a coaching progress report and go over everything that you did over the past 2 days. And then they give you grades, 1 to 5, whatever. I mean, typically it's 1 to 5, 5 being the best. And these reports stay in your file. And a lot of times they're going back to these coaching progress reports because for your annual raises, for promotions, these are a big part, guys, for your future. So take them very seriously. All right. So you want to nail these ride-alongs. Okay. Don't take them lightly. Hiring managers or your manager, not a hiring manager, they might tell you, because you're going to put your guard down again. Don't ever have your guard down. They're going to say, I just want to see a real day. Don't plan anything special for me. Guys, listen to me. Don't listen to that. Okay. I've done this in the past, and I've done real days where I had no lunches, no appointments set. I'm out there kind of just winging it. I mean, I always like to come prepared, but I'm honest here. A lot of days I went in there and I didn't know where to go that day. And I'm just cruising around going to see doctors, whoever would see me, because I've seen people a ton of times that month. I don't know what else to do. It happens, guys. It's normal. Okay. You don't have any cases today. You're not meeting with any patients. Some days you don't know where to go. Okay. So you don't want that day to be the day with your boss, because they will put that in the CPR. And if not, they're going to make a mental note. Okay. So when they say, I just want to see a real day, trust me, guys, make it as action-packed as possible. Okay. So if and to all hiring managers out there, they should be letting you know ahead of time on when they're going to be riding with you. Any hiring manager that just drops a bomb on you and says they're going to work with you tomorrow morning, that's a terrible manager, guys. Okay. And all managers out there, please don't do this, because I know there are managers that do this to try to trip people up, or when they're really riding someone, they try to, just come out of nowhere and blindside them. and go into and go on a ride along with them. Don't do that, guys. It's really, really unprofessional. It's unfair to the rep. So I always like to give the reps at least a 2-week notice to let them know when you're riding. A good manager should have their schedule for the next couple months with ride-alongs. So you should know, okay? So one quick tip before a ride-along, even if you have a ride-along in 2 weeks, you have a big appointment coming up this Friday, tell your manager, ask him you want him to be there. You don't have to wait for the ride-along for a big moment and say, oh, I wish you were with me 2 weeks ago because I really had this big meeting. So you want to invite them to those big meetings, even when it's not a ride-along. Okay, so don't wait just to show off in a couple of weeks. If it's urgent, do it right then and there, and invite your hiring manager to join you. Okay, when it comes to preparing for that in 2 weeks, so you have a ride along with your manager. The next today's the 2nd, the 16th, and 17th of July. Load up those days, guys. Get a breakfast and a lunch schedule both days. I would try to line up a dinner with the doctor, line up as many important meetings as possible. Make sure those days are action-packed. I used to like to not torture, but essentially torture the managers into working with them so early and keeping them out so late. Trust me, they do not want to come home and be driving home at 8:00 at night. But do that. Put them to the test. And really you're doing that because when your manager's around, good managers help you. So get them, look at it like it's a free mentor for the day. Use them as much as possible. Get as much information from them as you can, so so you're getting as much time with them and getting as much value as you can as possible. So I would look to set up as many in-services as you can in those 2 days. And more importantly, I don't care if this is staged or not, I always had better reviews when I went into the doctor's offices ahead of time and let them know that you're bringing your manager in. Now, some people say, why are you doing that, Joe? Don't make it fake. Don't make it staged. BS, guys. Get it staged, okay? You're not doing that to stage a performance. You're doing that to be respectful to the physician and the staff, okay? Because they could have a crazy day that in 2 weeks. And now they're trying to be nice to you because they got a good relationship with you and you've been such a good rep, but today's really a bad day and you're blindsiding them and coming in with your manager. So you don't want to do that. You could come ahead of time and say, hey, Dr. Jones, I'm going to be coming in next Wednesday, with my manager. I just want to make you aware, is there a good time that I come in? You know what, Joe, don't come in the morning. I'm slammed. I got a case in the morning too. Come in around 3:00. Guys, it's going to work wonders because you're showing the physician respect and you're also making sure that it's going to go as smoothly as possible. If you wing it, there's going to be offices that are going to be caught off guard and say, Joe, today is not a good day. And again, I've been there where I had multiple offices in a row and I couldn't, and it was a nightmare because I wasn't seeing anybody, and now that coaching progress report comes and who's getting a bad report. So prepare and ace this like it's an exam. Do everything you can to ace the exam. Okay. So we're a little past 3:30, guys. James, I just want to take a break right now and field some questions from the crowd and see if there's anything that I can answer.
For sure. We got Zahir Fakia. Thank you, Joseph. I'm doing a ride along or a field day with Smith and Nephew for a TDR role in Las Vegas. They're sending a fellow MSc graduate that did amazing in another territory and became a field trainer from another state to do an early day with me with a lunch break. Please advise about the best timing to do so. So sorry to text during your live. Should I take him in to prospect and potential accounts? What would crush it?
Okay, so you're doing a ride along with a Smith and Nephew graduate. For a Smith and Nephew role, and they're sending a medical sales college graduate to ride with you. So I'm assuming you're going to ride with that that graduate in their territory. And again, it's exactly what we were talking about earlier. It's that pre-call plan. Get on the phone with them and ask them, what's the day going to look like? Who you going to see? What are the procedures or whatever therapeutic areas you're going to be calling on that day, and do your research. Again, you don't have to be an all-star, a rock star that day, guys. You just want to respect their time and learn as much as possible. Straight up ask. You want to do your best? Call that rep and say, what would you do if you were me on this ride along? What could I do to best prepare? That's simple. Ask that one question. They're going to give you a ton of info, because I can give you snippets from this or that. I can't give you an exact snippet of what that specific rep's going to want. So just ask them. So if you ask that one question before you meet with them, they're going to give you a wealth of knowledge that you're going to be able to come better prepared.
We got Almost Famous Kid in Instagram said, listening from Venice, Italy.
Yes. Thank you, Almost Famous Kid.
Must be nice.
Yes.
We have Zahir again. How do we mention the other candidate without being intrusive and say we are a better pick with confidence?
How do we mention the other candidate without being intrusive and saying we are a better pick? I don't really understand that question, to be honest with you. I'm sorry. I don't understand the question. How do we mention the other candidate without being intrusive and say we were a better pick with confidence?
Yeah. My guess would be that there's another candidate that's going up for the job and he wants to mention
how am I a better pick?
Yeah.
Yeah. It doesn't matter who the other candidate is. So, I mean, that's the bottom line. It's about what you bring to the table. Why are you the best? So it shouldn't matter who you're going up against. Assume that you're going up against people with more experience. Assume that they've been doing, if it's an orthopedic role, they've been doing orthopedics for 25 years. So talk about, number one, if you have a lack of experience, talk about how you always own your development. Okay, that is the number one phrase. If you say that on every interview, you're going to get eyebrows raised. They love it, guys, because not only saying it, but doing it. I mean, that's the most important thing, is that you really do own your own development. When you go out there, you're doing all the research, all the homework, all the practice before you get out there. So you're the best prepared, and you're not waiting for the company to give that to you. You're doing it on your own. So whatever role, no one is going to put the work in like you did. But in order to say a statement like that, you have to be able to show that during the interview. So during the interview process, if you weren't reaching out to all the reps and to try to get more knowledge, if you weren't, working with a coach or working with individuals that can help you get a step ahead and doing all these things that show them that you're outworking everyone. You don't tell them. Showing them is much more impactful than saying, I outwork everyone. No, show me, give examples how you did that during this interview process. So do that, and don't worry about who you're going up against, because you're never going to know. Always assume you're going up against the best, but talk about all the things that have made you successful in the past and how you're going to bring that there to be the best candidate.
Okay. What's a mistake that you see people make when they finally land a ride along?
Being too relaxed. That's definitely, it's almost like popping champagne, celebrating time, where this is just a fun day to get to know another rep, and they're going to give you an offer, and this is just a formality, where I'm supposed to get closer with the rep, and he's going to show me around town, show me how cases work, because I'm definitely going to get the offer. So I got to learn what kind of cases I'm going to be covering. Do not take it lightly, guys. You did not get the job yet. I don't even care if they sent out a verbal offer at this point. It doesn't mean anything. So take that as seriously as possible and Do not bring your cell phone into the accounts, especially turned on. If you're going to bring it, keep it in your pocket, keep it in your bag, whatever, keep it in the locker. The less you look at your cell phone, if I know I've said this 10 times on this call, but it increases your chances of getting the job exponentially. The less you look at it, better chances you have to getting a job. So do those things and you'll have your best chance of standing out.
Would it make sense to write a recap or summary of what I learned during the ride along and share it with the hiring manager or rep afterwards?
100%. That's actually a great idea. Definitely take notes. Like we said, having that notepad out is your number one tool. But giving a nice summary at the end of the day, thanking that hiring, that sales rep, just like you would to a hiring manager after an interview, where you're reaching out to them and giving your thank you, and you're recapping on what you learned that day and what you're going to follow up with. Same with the rep. Provide a nice summary, talk about the cases and what you've learned, some of the things that you might still have questions about, but share all those notes in a summary. I think that's an outstanding idea.
Follow up to that, what should I be listening for or taking notes on during the ride along? Is there a checklist or framework that you use?
There's no exact checklist. It's more about, number one, finding out from that rep ahead of time what the day entails, and device is going to be different than pharma. Pharma is going to be a list of doctors that you're going to be in and out. You might want to ask straight up, are we going to do any in-services, any breakfast, lunches, or dinners? Who are we meeting with? Is there anyone ahead of time that I could do some research on? Any hospitals or hospital systems that you want to look into that you're going into? So it's just basically what are the cases, looking them up, and the questions by looking up, doing your research ahead of time, you're going to have more questions. So do that research ahead of time, and the questions are going to come up by just not knowing what they're talking about. So those are great questions to have when you actually get into that interview, when you get into that ride along.
All right. What's the best way to follow up with the rep after I shadow, the rep that I shadow after a ride along?
Well, I think before you get out of the car that day, it's again, you should be picking this rep's brain throughout the day and straight up asking the person, okay, what's the best thing I can do, moving forward? Cause I really want this job, letting him know I want this, I'm so excited. I can't wait to get going. Talking about the reasons why you're excited, and that's when you bring up what you learned that day and how cool that was during the case when you saw your product, really help that patient, where they were able to, eliminate their arrhythmia and get them back to, a normal heartbeat, like something like that is like showing that, wow, like I can't believe how well the product works. When I saw the reaction from the patients, or I saw how much easier it made this for the physician, like going over all those stories that you learned, but bringing excitement into it, guys, and letting them know that you really want this job. What can I do? I want to be a part of this team, and then if they don't give you any info, you do exactly that. You follow, a write-up, thanking them, asking them for their support, to speak to the manager to get you on the team. Is there anything that you can do, before, the final decision is made to make them comfortable to be a team member? Talk to them, be straight up with them. I want to be a part of this team. What do you think? And let them answer. It's the same as closing during an interview. You don't have to, it's not some very specific, rigid structure at the end of a ride along. It's you should have made a good relationship in 7-8 hours with someone. So, this is where you could just be open, but let them know that you really want it. Don't leave there so quiet. When I say be quiet, I'm talking about being quiet in a case, in front of physicians when it's their show, it's that rep's show. I'm not talking about be quiet all day. So I hope no one misunderstands me there. talk during these, learn as much as you can, but make sure, just like in an interview, that you're getting their approval, because they're going to talk to that hiring manager. So get that feedback and then ask for the approval and the support to get you hired because you really want it.
Right. We got Zahir said, "Thank you. I appreciate your help, sir. One more question. Should I mention a potential account that I can close if I am hired? If I feel like, or I feel like that's what the hiring manager liked when I mentioned what I can add to the territory. Should I say that I can book a lunch with a provider or an admin person that I know during our field day? Is that too bold or too confident of a move? Should I follow their lead and wait on their plan for the day?"
Okay. And, just to sum up, because there's a few questions in there, I actually had a colleague, and we did this on one of our podcasts, who, Molly, who, I respect a lot. She had a great story about a rep that really blew her away during the interview process. This rep was interviewing for XYZ job, and he had some relationships. I forgot if it was cardiology or what the field was, but we'll just say cardiology. And they sell a cardiology product there. He actually knew one of he had a good relationship with one of the physicians that was, a key opinion leader that they were trying to get in front of. And during the ride along later that day, he scheduled a dinner with that physician. So if you do have a good contact and you're on a ride along and it is one of the call points that they're looking, that can potentially bring business to that company, definitely make that suggestion. Hey, I know Dr. Jones, I have a good relationship with him. If you like, I could reach out to them and try to schedule a dinner later tonight, or we could stop by his office, and obviously beforehand, you're talking with Dr. Jones to see if he's available that night. So definitely, if you have that connection, it can't hurt to make a suggestion, because it could go a long way. So, don't just say, oh, by the way, let's make a right. I want you to go to Dr. Jones. No, make the suggestion. Hey, I've got a good relationship. Would this be helpful? We can call on him and stop by his office. I can shoot him a text, see what's a good time, or I have availability tonight. He's available for dinner. If you like, we could get in front of him. It could go a long way, guys. And especially if they're looking to get business from that doctor and that's one of their targets, that will blow their minds. So yes, definitely do that.
Okay. What should I say if someone asks who I am during the ride along, like a nurse or a doctor?
Just honest. You're looking to start with the company you're interviewing, and you're hoping to be a part of the team soon. You don't have to play a fake role. Unless the rep tells you otherwise. Just be honest. You're there to learn. You don't have to create a fake title and make it seem like you're more important than who you are. They get it. Guys, they see hundreds of reps a week. They're all over the place. They know every story. They know when the manager's with them. They know the game. They're always going to be a little nicer when the manager's around because they don't want to screw up their rep. They get it. So they know that they've seen reps on ride-alongs for final interviews too. Just be honest. That's all.
And that's all I have for right now.
Okay. Well, I appreciate that. Thank you, James.
Keep the questions coming.
Yes, absolutely. Absolutely. Yeah. We just have a couple more talking points and then we'll wrap up. And another thing, guys, I mean, really at the end of the day, there's one last one that I do want to go over quickly. And that's you might get this, especially if you live close to the headquarters, and sometimes not. They're going to have other office or team personnel come with you on a ride along. So you might get someone from marketing or, clinical support, engineering, whoever it is, where they're just trying to learn from the day from you. Guys, again, always A game. All right. Don't take anything lightly. Don't think because this person is not your manager that it's time to keep your guard down and then have a beer with them at lunch. Do not. I mean, obviously I'm exaggerating with the beer at lunch, but I'm saying, like, just don't keep your guard down, guys, because this happens a lot. This is a unique ride along it's not going to happen monthly, but a lot of times, especially it could happen when you're doing well. A lot of times when reps are having a couple good quarters, they send out other team members to find out, especially in marketing. They always want to find out what's working. And if you're doing good, the good thing about that is, you're on the radar. Everyone wants to know what you're doing. The bad thing is they're going to want to see it. So, not to say it's a bad thing, but again, nobody really wants to have someone riding with them every other week. You want to be able to go out there and do your thing and not have someone looking over your shoulder. So you could have these come up. Treat these just as serious as you are with a hiring manager and with another rep. Because I've had that in the past. Again, don't let your guard down. Don't get too comfortable. Show them a day that they really, that would really knock their socks off. Don't get lazy. Because there's times that you're like, oh man, I got to ride with this guy now, and I want to be home by 4. Because I got to go to drive far to a dinner, or I'm meeting friends, or I want to hit the gym. This is not the day to cut out early. Just because you have other obligations it comes up in all our lives. So definitely take it as seriously as the others, and look at it as a compliment and a chance to really show your skills to other members in the company that would never normally see you. So they can, your name could get thrown around different apartments. And this is how you become a team leader and a thought leader throughout the company. So, I mean, that was pretty much, that sums up everything today. James, I don't know if we have any other questions that have come in. Okay. Jenny, is there always a ride along before every offer? No. That it depends on the company. It depends on their protocol. But they do happen a lot. So I'd say more than half the time, especially in the medical device side, they want to really make sure if you're going to be covering cases that you really know what you're getting yourself into, especially for newer reps. They want to make sure that you can handle the stress of the OR. My first case that I ever saw, I was in college and I was observing a TMJ case, and I thought, the whole time I'm like, don't be grossed out by blood. Don't be grossed out by, seeing all the anatomy live. And the one thing that got me dizzy, which I never prepared for until you're there, was the lighting above the bed. It was so much in my face that I started getting like this, and I was ready to collapse. And the doctor saw me, the oral surgeon saw me, he goes, "You okay?" And he's like, "Just lean up against the wall." And it's embarrassing to say, I had to lean up against the wall for a couple minutes to get my breath. And then the dizziness went away and I was able to go back in. So that was something I would never have known unless I was observing a case. So a lot of these companies, they want to make sure that you really are understanding of the environment that you're about to get into. So they want you to do that right along.
Can I use the ride along experience in my interviews? And if so, how do I frame it without dropping names or crossing the line?
Well, definitely you don't have to worry about dropping names because they set up the ride along. So they know the rep that you're working with. The customers for the hospital, the company's customers. So there's not going to be any real secrets that, you want to talk about what you learned. I mean, obviously if a rep is going to open up and say things about the manager to you or another team member or be negative, I mean, obviously you're never going back and telling the manager that. That's just common sense. You're going to keep that to yourself. But if it's a lot of negative feedback, you do keep it to yourself and then say, "Hey, you know what? I don't like the way this smells. This is not for me," and take that as a red flag and just move on. But you don't have to worry about coming back to a manager, and name dropping anything, because it's really only you and that rep and the doctors that are their customers anyway. You want to talk about what you learned. But again, if it's all negative, keep it to yourself and then just move on to another role. Excuse me.
Besides using the phone, is there any other thing that can cause a ride along to backfire?
Not asking questions, not being engaged, being silent in the car the whole time. That's not the time to be silent. In front of customers is when you want to be quiet. Like I said earlier, show excitement. If you don't show excitement, they don't want you. If you show excitement, that increases your chances. So always come with enthusiasm. Always show and tell them why. Not just, oh, I'm really excited. I'm really excited. Like, no, that's not enough, guys. I mean, come with that excitement, but really explain why you really want this. And they feel that. When they know that they have someone that really wants this job, they're going to be willing to make an offer. If they think that someone's like lukewarm, and it might just be your personality, you got to snap out of that, because they're going to go, I'm not going to make an offer to him, because if he doesn't take the job now, or if he leaves after a couple of weeks, then I'm not, we're back to where we started from. So you don't want that to happen. Show that excitement and explain what is so exciting about the role.
Jenny said, wow, interesting. I never would have thought of that. Out of all the things, the lightings, I appreciate that response. And
Absolutely.
then last question, I think, unless someone drops one in last minute. Where did it go? Do ride-alongs ever lead directly to job offers, or are they more of a stepping stone?
I mean, typically the ride along would be the last step. I've heard of cases where they did bring multiple reps on a ride along because they really didn't know, who who they wanted yet. So they let the ride along be the final decision. But you might hear, I mean, again, there's always outliers. Typically that's the last step before they make a final offer, but there have been times where it's a ride along and then a final interview with the vice president or the CEO or whoever is the final decision maker at a smaller company. It could be, but usually that ride along, they have a good idea that they want you. They want to see how you interact in the field with customers and with your future colleague. But if you nail the ride along, you're in a really good spot to get the job.
And yeah, that is all the questions that we have today, Joe.
Awesome. Thank you, James. I appreciate that.
As always. No
Absolutely, man. And I want to thank everyone again for joining. Again, guys, we're going to be here every Wednesday at 3 p.m. Eastern. We're in a couple of weeks, and I'll send this out on a new schedule. We're going to be breaking down the podcast into 2 podcasts a week. One would be more for entry-level reps, and one is going to be more advanced training for some of you guys that have been in the field from, not only rep positions, but into management. And we're going to get into more complex conversations to be able to help you guys out too. And obviously I want everyone to join to provide their insight, because I learned just as much from you guys being on these calls, the questions you asked and the interaction. So that helps me a lot. Again, as a reminder, please make sure that you subscribe to my YouTube channel, Unfiltered Medical Sales Coaching. You're going to get all this content and more, and we're constantly coming out with more and more content every day, guys. So to get unlimited access, please make sure you subscribe. Also, for any lobby members, please take down the promo code for today, which is Licata, Licata. Any lobby members that are on the call, please take down that code. Message me if you're looking for any one-on-one coaching for not only lobby members, but anyone else on the call. Feel free to reach out to me to go over your specific challenges and concerns that you're having. More than happy to help. If you present that code, you'll be able to get additional discounts for training. And I thank you guys again. Thank you for being a part of the call. And I look forward to speaking with you guys again next week, same time, 3 p.m. on Wednesdays. Take care, guys.